Good afternoon, everybody. My name is Barry Hudson. I'm Director of Public Information for Montgomery County, and welcome to our weekly press briefing with County Executive Marc Elrich. Today, we have a number of guests who will be participating to answer questions about the recently discussed school safety plan. But we also have our normal attendees who are Dr. Earl Stoddard and Sean O'Donnell, who are here to join the county executive. So without further ado, before I do that though, I want to remind reporters, if you have questions, please put them in the chat and indicate your news organization. Just to let you know, we do have a hard stop today at 1:15. So I would ask you to make sure when you ask your questions, you put the one that's most important forward. We won't allow for a whole lot of follow-up. We've got a lot of questions, so we make sure we get to everyone. So without further ado, I am going to hand it over to County Executive Elrich to do his opening remarks.
So thank you all for joining us today. Before we begin, there was an incident that happened last night to Councilmember Jawando at a Progressive Legacy online forum that I just want to comment on. This is the second week of Black History Month, and another round of threats have been visited on our HBCUs. And now we've had this hate-filled verbal racist attack on Councilmember Jawando. This is not where this society should be in 2022. It is really disappointing that people feel this is an appropriate way to behave. I know this isn't the first and it's not going to be the last time. And Will's had to deal with attacks of this nature before, and it's a testament to his character and strength to continue to fight for what he believes is best for Montgomery County. The people making these attacks ought to put their names on them. If they're so proud of what they're doing and so proud of what they think, own it. Let us know who you are. It's embarrassing, and frankly, it's disgusting. I offer my unwavering support to Will and his family and his staff, and I want to ensure the public that this incident, like all incidents of hate, will be thoroughly investigated and prosecuted by this government. Speaking of Councilmember Jawando, he sent over a request to rename the Silver Spring Library for General Charles McGee, member of the Tuskegee Airmen, who lived in this county for 30 years and recently died. And I'm going to be supporting this. Also today is the funeral for MCPD officer Douglas Haggerty, who died last week in a tragic off-duty car accident. Officer Haggerty served our county as a patrol officer for 12 years and was dedicated to protecting our community. He leaves behind a legacy of commitment and service to the people of this county that should serve as an example to us all. I hope the residents of Montgomery County continue to keep the Haggerty family, as well as the staff and officers of MCPD, in your thoughts during this very difficult time for them. And I just ask that we all take a moment of silence to honor them. Okay, today I'm pleased to be joined by MCPD Assistant Chief Carmen Facciolo, who is our police department's first civilian assistant chief, along with MCPS Chief of Staff Jimmy D'Andrea, to talk about updates to Community Engagement Officer Program. We will turn it over to Carmen and Jimmy after our weekly COVID update. The good news is that our COVID rates continue to decline. Our test positivity rate has dropped to around 3.5%, and our case rate has dropped to just 17.82 per 100,000 residents. The lowest rate we've seen in the last 2 months, just a month ago, our case rate was 305.25 per 100,000 residents. On the other hand, last summer at the low point, our case rate was a fraction of this. It is incredible how quick the Omicron surge arrived and receded, but what a devastating impact it had on our county and our nation, especially on our hospital systems. It's important to note, as you can see clearly from this chart, we are still in high transmission in Montgomery County, and our numbers are below the state average. Just today, the governor asked the Board of Education to rescind the mask order in our state for the schools. He should be patient. Trends are good. The trends are very good. we are likely to be out of high transmission in the not too distant future, but we've not yet returned to even a level of moderate transmission. And I would be much more comfortable if the governor would set that goal, set it on a county by county basis, but set a goal that at least we're in moderate transmission, not in high transmission. This week, our nation marked another grim milestone. We have lost 900,000 Americans to COVID. It took our nation only 50 days to register 100,000 deaths, after it took 75 days to go from 700,000 to 800,000. This is due to the Omicron variant and the strains on our health systems. These are sobering numbers and an unnecessary tragedy. The country did not respond the way it should have to this virus from the onset. And we continue to have a significant portion of our population not believing in data, science, and facts, leading to bad health practices and poor decision-making. Stunningly, after having the vaccine available, 35.8% of our nation remains unvaccinated. So many of these deaths could have been preventable if more people would have been vaccinated. Montgomery County's lost 1,945 residents to this pandemic, but if our death rate matched the rest of the nation, we would have seen 2,700 deaths at this point. That is 40% more deaths if we had been like the rest of the nation. Additionally, for our county, 80% of the deaths occurred before the vaccines were widely available. That disproportionate ratio, in a good way, is due to our county government's healthcare, school system, businesses, and most importantly, our residents doing what was right for themselves, our families, and our communities. I continue to be appreciative of our residents' understanding and patience and vigilance to keep the county as safe and healthy as possible. As we turn the page from this surge, hopefully, I'm proud of and pleased with our ability to be flexible and adaptable in our government and throughout our community. One such success over the last month has been the distribution of our take-home rapid tests. We've distributed about 1.5 million rapid test kits, and about half of those were distributed through our libraries, along with 700,000 face masks. And we continue to provide rapid tests to our schools, both public and private, childcare providers, senior facilities, and many of our community partners. This volume of rapid test distribution is more than any other jurisdiction throughout our state and region. Our vaccination and booster numbers continue to slow down, unfortunately. Just 2 weeks ago, we boosted 22,000 individuals. Last week, it was only 10,000. Our 18 to 64-year-old Black and Latino residents are only 44% and 39% boosted respectively. And 25% of our 65 and older groups still need their booster. This age cohort is more likely to have pre-existing conditions and weaker immune systems, leading to the serious and severe symptoms if they catch COVID, even if they were originally vaccinated. And this is an important thing we need to emphasize. The vaccines worked, but the vaccines also wear off after a while. And if you got your 2 vaccines, you did what we thought you needed to do, that's great. But as your immunity wanes, you need to get a booster vaccine. That is the only way you can be protected from more severe outcomes of COVID. You may still get Omicron, but people who got Omicron and were boosted had much less severity in their cases and suffered far fewer deaths. So getting the booster vaccine really matters. And this is not the flu. For people who are out there telling you it's just like the flu and you get a minor cold. Yeah, some people get a minor cold. I had a minor case of COVID, a little bit still hanging on, but a minor case. That is not true for everybody. So it's great when it's minor. It's not so good if it's not minor. The bottom line is whether it's a child or a grandparent, we all must remember and encourage the importance of getting boosted. The governor announced the state's going to do another lottery to help promote boosters, and I hope it works. Here in Montgomery County, we're focusing our efforts on getting more people boosted as well. We're hosting our second Boosterama on Saturday, February 19th, President's Day weekend at Westfield Wheaton from 1 p.m. to 4 p.m. Our first Boosterama in December vaccinated 420 people in just 3 hours. It was a great success, and we're hoping we can do even better this time. On a couple of non-COVID related matters, first I want to congratulate Dr. Manifa McKnight on being selected by the Board of Education as Montgomery County's Public Schools new superintendent. I've worked with Dr. McKnight during her time as acting superintendent. She's had to deal with the tremendous challenges that COVID-19 has created, and it's not an easy task. There was no off-the-shelf playbook to guide any of us. She's fortunate to work with teachers, principals, and support staff that, like Dr. McKnight, have demonstrated a great sense of compassion for our children's education and well-being. I look forward to working with her as we recover from this pandemic and to address the myriad of challenges that COVID-19 has amplified. Addressing these challenges can require continued investment in our school system, which is why I recently recommended a record level of capital investment to provide resources for response and recovery efforts. These investments are important to ensure that the school system she leads has the resources that they need. This is an historic moment as the first woman and the second person of color steps forward to lead Maryland's largest school district, where 73% of the students and families are people of color. Dr. McKnight brings a wealth of experience to the position. I look forward to supporting her work to ensure that all our children are college and career ready. And I also look forward to working with Dr. McKnight and the Board of Education as we move forward to continue the excellence of our school system. In another event this week, I testified in support of a bill in the General Assembly that would ban ghost guns. Ghost guns are guns that are unregistered and untraceable firearms. In fact, the gun used to shoot the student at Magruder High School was a recently purchased ghost gun. I applaud Maryland Attorney General Brian Frosh for his leadership on this issue, and I want to recognize Delegate Lindsay Lopez for a tireless commitment to stop the supply of these guns that are increasingly making their ways onto our streets and into our community schools. I'm now going to turn this over to Dr. Stoddard and Sean O'Donnell for their COVID update before we bring Carmen and Jimmy into the briefing. And they'll be answering questions about changes to our community engagement officer program. After the tragic incident last month at Magruder, along with other incidents of concern throughout the county, MCPS and MCPD have been working collaboratively on making needed adjustments to the community engagement officer model. And they will be going over those adjustments. Thank you.
Thank you, Mr. Elrich. I would just ask if I could be given the ability to share my screen. Thank you. So to add on a few additional updates in what we are seeing with our metrics, our hospitalizations have continued to come down. We are now down to 163 patients across Montgomery County hospitals with a COVID-19 diagnosis. 80 of those are in acute care beds at our primary hospitals, and we're down to 25 in ICU beds. Very encouraging news. We have additional 58 patients who are stabilized, mostly acute care, but some ICU at the alternate care center run by Adventist in Tacoma Park. To follow on again, the anecdotal reports of individuals with COVID are often very positive over the last several weeks. And I'm happy that many people's experience has been a minor illness, but in aggregate, it's been very serious. Again, we've seen through the month of January more COVID deaths in our county than the last 6 months combined. Still a far lower rate than across the state, which again ranked as the deadliest month for COVID since the pandemic began in the state of Maryland. We'll continue to provide guidance to our elected officials and to our private sector partners and our school partners as we work towards lower transmission rates, lower positivity rates, and eventually stepping back from some of the community restrictions, including masks and other things. We'll continue to offer guidance on how to do that safely. We certainly want to keep seeing these trends go in the right direction. We are still in the midst of doing vaccinations for our 5 to 11-year-olds. we are starting to see, we're still seeing them come in, but at slower rates. We're strongly encouraging our parents and families to, if they have not had their children vaccinated yet and they're eligible, to come out. Some of the older kids are now eligible for boosters. Also encouraging them to come out. Again, this is being vaccinated and having your boosters when you're eligible for your boosters helps us keep kids in school. It reduces the transmission. It reduces the amount of time that you need to be quarantined or isolated. We're in conversations with our school partners. We know that each school district, and including the private schools, have to make decisions about how they're going to implement this. But we are in conversations with them, much as the governor has started, about what would be the metrics and what would be the timing for implementing reduced time in quarantine, reduced time in isolation. So that's ongoing. I don't have any updates at the moment as to when those are, but just letting folks know that those conversations occur, and getting our kids vaccinated is probably the biggest step towards being able to do that. Our testing capacity is very high right now. The amount of individuals coming out to our publicly run testing sites it continues to decrease as we move away from the holidays and holiday travel. We hope people are still testing if they're concerned about it, especially if they've had exposures or if they're symptomatic. We know lots of folks are doing this with rapid tests, and just want to remind individuals, if you have a positive rapid test, please report that through the county portal that's available online, or you can call our COVID call center, and they'll help you report it as well. The one other thing I'd like to share is just a brief update on vaccination eligibility for our children under 5. We participated in a nationwide call last night with Pfizer and with the CDC, where we got some updates from the manufacturer. We are aware that the FDA will be looking at data on February 15th if their schedule holds, and we've been notified that we may receive shipments of vaccine as early as the week of February 21st. This again is all predicated on starting when FDA, CDC, and the state all provide that approval process and guidance to go forward with it, just giving the potential timetable that could happen if it all falls into place. The one other thing is, we are aware that this would be an updated formulary from Pfizer, which means part of the rollout and timing of it will be the distribution from Pfizer out to the localities, out to providers, so that we can begin distributing that vaccine. We will not be using the previously manufactured vaccine. Although this is the same vaccine that Pfizer's been using for other age groups, it's just formulated in a slightly different dosage, and will come in different capsules. So we'll wait for that distribution. We also anticipate, as Pfizer and the CDC has mentioned, that this age group will likely have a larger participation from our pediatricians and primary care providers. So we'll continue to work with them, work with our Head Start programs, and work with our childcare programs to make sure they have information about when this is happening, and we can get this out to our community family members to let them know where to go to get vaccinated, both in the private sector and in the public sector. Dr. Stoddard, do you have any updates you'd like to share?
Yeah, just a couple additional. So as Mr. O'Donnell alluded to, obviously the Board of Health Regulation has mask mandate through February 21st. As Dr. Bridgers and I and Mr. O'Donnell said on Tuesday, we aren't anticipating sending over any additional recommendation to extend that timeline. So I think that's, and hearing from the Council of Cities, the Board of Health, I think their anticipation is that would be the expiration date for the county. Now, obviously that does not influence the schools. The schools are currently governed by the Maryland State Department of Education's requirement for face coverings in schools. It is our understanding from the Maryland Department of Health that the MSDE will be meeting later this month to look at a set of metrics upon which they would base a decision to remove or allow jurisdictions to decide to remove face coverings in schools. And obviously at that point, then we will work with MCPS, and the Board of Education will ultimately make the decision for the school system. But we're committed within the public health, within the Department of Health and Human Services and among the public health team to work with the schools, provide them whatever guidance they seek from us, give them as much information and recommendations as they can. Then they'll make the decision on how to proceed for the school system. So that's just the brief description of the process. But until the Maryland State Department of Education meets and makes a determination about how to alleviate them statewide, then obviously there is a preclusion from the county from doing anything different, at least until that conversation happens. So those are the only two things I wanted to cover this morning. We'll turn it back over to Barry right now.
Thank you, Earl. And just as a reminder, we have representatives here from the police department and the school system to answer questions. They won't be doing a presentation. In the interest of time, we only have about 30 minutes left. Joining us also as a part of that team from the school system is Rochelle Rubin, who is the Chief of Teaching, Learning, and Schools for the Montgomery County Public Schools. So we will now open the floor to questions. Remember, reporters, please put your questions in the chat. Our first question today is from Kate Ryan from WTOP.
Thank you very much. County Executive, again, on the mask mandate and schools, and I know Dr. Stoddard just said there's a separate sort of process for schools. What are your concerns with the press to get rid of mask mandates in schools? And again, given our stats, my understanding was the Maryland State Board said if the community or the school system itself is below 80% transmission rate, then schools could go ahead and take the masks off. Where do we stand? And again, what are your thoughts on the press to get that done?
I have not seen that number. I just was reacting to the governor's comment today. We're still in high transmission, and in high transmission, we wouldn't have even been having this discussion before. Most everybody took steps like putting on masks in order to bring these transmission numbers down. So, again, it's the kind of situation that's been repeated. We do things, result of doing things is we get to see rates start moving back in the direction we want them to go to. And then instead of achieving a goal, such as let's at least be in moderate transmission, the decision is, well, we're moving in the right direction. Right direction is great. I'm confident we're going to get to moderate transmission, but I don't think the time to take masks off is during a period of high transmission.
Got it. Quick follow-up for you on what happened to Councilmember Jawando. Is there any indication that this falls into a hate crime? Is there law enforcement involved? And are you seeing an increase in this type of action to your peers on the council or in your own experience?
There's a level of ugliness I've never seen before. Mine doesn't focus on, race. I don't get targeted that way. It's other stuff. But, this is not the first time Will's experienced this. I know Nancy's experienced this before as well. So, there's way too much of this stuff going on. You see it on Facebook, you see the side comments that people make. And, it just should not be that way. So, I don't see how it's not a hate incident. And I believe it's going to be treated as one. That kind of public calling out and using a racial slur is just flat out not acceptable. And I hope they find them.
And I would also say, Kate, with county executive, we've been conducting interviews for a health officer, and in every interview, we've had to ask them how they would respond to derogatory comments or hate-filled speech, because we know that is a possibility. Dr. Gales faced that when he was with us. I'm sure Dr. Bridgers, if he would here, would tell you he'd seen it as well. But obviously, we've had to ask candidates, which is not something a position I thought. It's not a position we should have to be in to have to ask that question in an interview of candidates about how they would respond to, those kinds of degrading, hate-filled comments. And so that's just a reflection of the fact that there is an increase, certainly in the time of COVID. There's been articles written, and I think they're spot on, that, you know, COVID has exacerbated things that were already there, just in terms of behaviors and, our unwillingness to communicate with one another in a reasonable, rational way. And I think it's just a reflection of some of the really negative mental health consequences of a pandemic generally, but also, you know, again, they typically exacerbate underlying feelings and emotions that were there all along.
Right. So again, just to be clear, police are looking into this, or does it rise to that level?
I don't know whether the police are looking into this specific incident. Obviously, their, speech is generally protected. Even hate speech is generally protected. Now, I don't know if there were other, any issues there. So I'll certainly take that back, but I don't know offhand that police are investigating anything like this.
Okay, appreciate it. Thank you.
Next question is from Tom from Fox 5. Tom. Tom, you there?
Please unmute, Tom.
Yeah, I'm having some computer issues here. Can you hear me now?
Yep.
Great. I want to get back to the governor's letter. Good afternoon, County Executive. He had told us in a briefing on Tuesday that he did not want to try to act unilaterally like the Virginia governor did and now finds himself in court. What is the issue with the board even looking at this, though? Because you've got California, New Jersey, New York, hardly conservative hotbeds moving in this direction. Shouldn't the state of Maryland be moving in this direction as well, too, if the numbers say they are as good as they look right now, and we don't have the data that shows that the masks are in any way a problem for those other jurisdictions that are dropping these things right now?
But you're not going to know if it's a problem until you see what happens after you drop them. The governor made movements early, throughout this pandemic where he lightened things up and other people were lightening things up. And I will say almost every time he did that, our numbers jumped back up. Every time he loosened things up, the numbers responded. And there was no point during this crisis that anybody would have said high transmission is a goal. It was never the governor's original goal. We were tightening things down when you hit the high transmission, not loosening things up. So they're free to look whatever they want. He can say whatever he wants, but I think he would serve us all better if he was a little bit more patient about it and got us at least into the moderate transmission range.
I would also note, Tom, that some states have removed their mask mandate, like New York and California, who you cited, have removed them in public settings. But I don't believe New York or California or some of the other states who have removed them in public settings have opined on their school settings yet. And so there is distinct. I know New York,
New Jersey did.
New Jersey did, but I'm saying I wouldn't. There's inconsistency across the country right now. New York State is keeping them in schools. California, I believe, they said they didn't. They said they were removing them in public settings, but they weren't ready to talk about schools yet when they spoke yesterday. And so I was just pointing out that there is this ongoing debate, and there is some differences across the country. I'm just not saying it's not as uniform in school systems as you're suggesting it is my point.
So just to put a bow on this, you're against what the governor did and you're not interested in moving towards getting rid of these masks in the schools?
I am interested in getting rid of masks in the schools. I just want to be at a number when I can look at it with a straight face and say we've reached a better place. Like I said, in high transmission, we never would have done that. So I don't understand what logically has changed. If high transmission was deemed to be too high a level of spread to have taken protections off and actually triggered protections going on, I don't understand how that's suddenly the measure that you take protections off. I'm confident we're going to get there. I don't believe anybody will be unduly harmed by waiting another couple of weeks and wearing a mask. I haven't been harmed in 2 years of wearing a mask, and I don't know anybody really who has. So it obviously it's going to be what it's going to be.
All right.
And hopefully he'll give school systems the latitude to make their own decisions. I would have been happier if he just said any school system that hits moderate can take it off. And that way different schools may hit it at different times.
One last quick one. Somebody who agrees with you is the CDC director, Rochelle Lewinsky. She said yesterday, now's not the time to take off masks. At one time, Montgomery County said 85% vaccination rate was going to be the target. We're looking at February 21st for the county mandate to come down. Can you say right now whether that's going to happen or could happen sooner?
I can't say. That's under the Board of Health now. And so they'll make a decision that they think is right. I would say that the same rule applies though. If you're in high transmission, and we wouldn't have done this before when we were in high transmission, maybe we shouldn't do it now. I mean, I think you've got to allow that, given the development of COVID, the things we thought, I mean, people thought you were going to get herd immunity at 80%. You may remember those discussions. There is no herd immunity at 80%. So it may have been an okay thought, but practice has proven to be that didn't happen. So it doesn't make a very good metric if the thing you thought was going to happen doesn't happen.
Thank you.
Thank you, Tom. Our next question is from Steve from Bethesda Beat. He has a question for representative for the school system as well as health officials. Steve, go ahead.
Yeah, I know the county executive just kind of weighed in on the masking situation, but I'm wondering if Jimmy can kind of respond to that as well. One of the things I thought of, and maybe it's been asked, is that there's been a lot of chatter about masks in schools, and for kids that need speech development and things along those lines, wearing a mask can be kind of disruptive in those environments. And is there any law or something that prevents a carve out, if masks need to be kept in schools, that you can't separate out those kids, I guess, to kind of help them out or create exceptions, kind of like with the vaccine, there are religious and medical exemptions. Can that be done, I guess, in this context, if that makes sense?
Stephen, thank you for that question. Just to follow up in a couple of different ways, I'll start by saying that, after the county mask mandate is lifted and pending the final outcome from what MSTE says, then MCPS will work closely with DHHS in terms of next steps with the mask mandate that's currently in place for all MCPS facilities. We do recognize that there are very limited exceptions for students in some cases and some of our programs throughout the school system who are not able to consistently wear a mask throughout the day for various reasons. And then we also do provide specialty masks in some cases, depending on the need. So for example, there are definitely, clear masks provided for students in some instances where that will be helpful to them in the progression of their academic day. So at the end of the day, we work closely with schools. Masks are absolutely required, but we recognize that due to significant needs in some cases, there are very limited exceptions where there are students who are not able to consistently wear a mask the entire day.
So if the state board decides, in this hypothetical in the coming weeks to lift the mandate, is that something you and the health officials feel, if the trends continue, that will fall in line with what the state board does?
After that information comes out, we will work closely with DHHS in terms of next steps. We have not made any decision at this point.
This last one's for Sean. You mentioned that you want to call Pfizer, you and others, for the vaccine for people under 5. Is that similar to the 5 to 11 in terms of emergency authorization and how that's going to progress moving forward in terms of the approvals through the CDC and FDA, I guess?
Yeah, we anticipate that it would be a very, very similar process. Once the FDA looks at the data, and admittedly, the range of children from 6 months to 4 years is a pretty good difference in body size and lots of other things biologically. So they're going to provide a very intense review of the vaccine. From the early reports, they already have very good safety data. Now they're looking at efficacy data with the amount of vaccine that they have been using in the trials. And I know they've also discussed whether potentially a third dose will be needed at some point in relation to the first 2 doses. So all of that will be reviewed by the FDA. They'll provide their guidance, and we anticipate likely their approval. And once that happens, the CDC will convene their ACIP council, review the data, and then give more specific guidance on administration of the vaccine, so that we can do this consistently across private providers, across jurisdictions, and the state then sort of codifies that for the state of Maryland, and at that point we'll be ready to go. Now, in the past, those steps have happened pretty quickly with each other. So again, we've been given that tentative distribution date of potentially the week of the 21st for that vaccine.
And you imagine, like you said, pediatricians and private providers are going to be more heavily involved even than you were in the 5 to 11. Is that safe to say? Or
well, what we've seen even with the 5 to 11 is we've seen greater numbers of 11-year-olds come out and 10-year-olds come out than 5 and 6-year-olds. And of course, this is all predicated on the parents bringing their children to get vaccinated. And so that's to the publicly run sites. So we do believe that at the younger ages, parents are more likely to bring their child to a pediatrician. At very early ages, children they visit their pediatricians more frequently, so that their relationship is more established. And we think that'll likely happen again at this point. And again, for our private providers out there, they'll be able to order the vaccine the same way they did with 5 to 11 through the states. And we'll be there to help supplement that distribution if necessary.
thank you, everyone.
Okay, I don't see any more questions in the chat. Do we have any final questions from any reporters? Going once.
Can I get one more in?
Sure, go ahead, Kate.
It's Kate. Hey, from the school system, is Rochelle still with us, Ms. Rubin? Or Jimmy DeAndrea, if you can answer this one. On the mask situation, and you talked about there are carve-outs for children who, I don't know if it's a speech pathology sort of class or instruction that needs the masks, the clear masks used, et cetera. There are a lot of claims about the damaging effects of masks on students. Does the school system have any evidence as to damage that mask wearing does to children, either academically or socially and emotionally?
Good afternoon, Kate. We don't have any specific evidence that we have collected as a school system to that effect. But what I will say is we recognize that, prior to the pandemic, students were walking around without masks, and not having masks on definitely helps in the social emotional interactions and development that occur in schools on a day-to-day basis. As a result of the pandemic, we've always worked closely with the health officials in the Department of Health and Human Services to make sure that health and safety is our top priority. And so that is the reason that we have been continuing to require masks in all MCPS facilities. We want to be at a point where it is safe for students and staff to not be required to wear masks. But again, we defer to health officials and working together to make those determinations, because at the end of the day, I'll just emphasize that health and safety is our top priority.
Thank you. And if I can follow up one more thing with Mr. O'Donnell, since we have the time, I'm going to take it. Mr. O'Donnell, if you could, on the vaccination rates among children, you mentioned the 5 to 11 group. Again, I saw the breakdown by demographic, but overall, age 5 to 11, how many kids have gotten their first dose? How many kids are considered fully vaccinated?
I'm trying to pull that up right now.
I appreciate it.
So let me see if I can share that. Okay, so again, it's a little more difficult within that very specific age range because of how census data works out and is collected. And so what we're looking at is a projection that we're in the upper 60 percentile for first doses within our 5 to 11, and that fully vaccinated, we're more than 50%. We're likely around 53, 54%. And this climbs up, this has been climbing up by 1 to 2 percentage points each week that we've reported this. Certainly a slower rate than earlier on, but we're continuing to work with our partners at MCPS on holding these clinics. We've now gone to, as of this week, we've gone to every Title I school at least twice to do first and second doses. In some cases, we've gone to those schools multiple times. We've held additional clinics on the weekends at larger middle schools and high schools. And again, what we're trying to do is just get vaccine out and make it available to members of our community throughout the geographic area of Montgomery County. We're trying to make up some ground at vaccination rates in our East County areas, in our Germantown and Gaithersburg areas. But in general, the distribution geographically has worked a little bit better with this age group than it has in previous age groups. And a lot of that is credit to the partnership we've had with MCPS that allows us to get out into very specific communities, offer vaccine events that are more convenient to parents. Again, what I think I've mentioned this on some of our previous meetings, is that there's a lot of different reasons why individuals, or in this case, families, may wait a while to get a vaccination. And in some cases, it's convenience or it's priority. And we know that there's a lot of competing priorities in December and in January as we were going through Omicron. Lots of people had illnesses in their family and lots of things going on around the holidays that may have lowered the priority to come out and get a vaccination, whether it's for a young child or for a booster. And we're hoping we're getting back to a point where we can raise that amongst, we know we're competing with other priorities. We're just hoping that people can take some time, get their kids vaccinated, so that, again, a very important thing is not just protecting their health, but being able to keep them in school. And that is helping us do that, so that when if there is an exposure in a school, that if they are up to date on their vaccinations, they would not need to be quarantined. And that's a really, I think, an excellent reason to have your kids vaccinated. But that's where we are right now with the vaccinations.
Got it. And just so I'm clear, is two doses for kids fully vaccinated? That's all I need to know. Is 2 doses for 5 to 11 fully vaccinated?
Yes. Yeah. They would not have been eligible yet to get a booster.
For boosters. Yes. Thank you. Thank you. I appreciate it.
Thank you. Before we go, I just want to make sure we remind everybody, we do have representatives here from police department and the school system. If there are any questions about the changes to the SRO CEO program, this is your opportunity to do that. We've got about 7 minutes left before we have to go.
Well, since we do have that, right now, how many CEOs are currently working in the system, and where and how are they deployed? I know there's a discussion about getting them offices in schools. How close are we to that?
Hi, this is Assistant Chief Fasciolo. Thanks for that question. Currently, we have 21 CEOs working. We have authorization for 23. 2 of those positions are in the process, and we are looking to fill at some point within the next year, if possible, if funding levels remain the same. They are currently deployed to our high schools, working throughout the day at our high schools, and then responding to calls for service at our middle and elementary schools if necessary. We are actively working with MCPS to implement a plan that was discussed not only at the Board of Education, but in other venues this week. We'll circle back to you on a better timeline of when that will be implemented, but there are some training components, officer conversations, and education for our principals as well as our CEOs. So the timing will be determined by when that all can get done.
Got it. And there was a discussion of the word or phrase was used, demilitarizing the uniforms. What would that look like, and what has to happen in order to do that? And was that a student suggestion or a community suggestion, or do the officers feel, yeah, I could be comfortable out of my tactical uniform?
Of course. So during a variety of work sessions with MCPS and MCPD, we held a few collaborative conversations, both with our principals, our CEOs, and our young people in schools. It was actually the young people that addressed this. The young people were overwhelmingly in favor of having police officers in schools, and actually said that they wanted to build relationships with officers. However, they did say that sometimes the fear of the tactical uniforms or the uniforms that officers wear were scary and prohibited relationships from being built. We're actively looking into how we can change uniforms. Obviously, that this is a collective bargaining issue with the FOP. However, we're seeing if officers could wear detective style uniforms or plain clothes so that they are not so, quote unquote, as the students say, militarized, and look more as if they're blending in with the other faculty and staff within the school system.
Got it. Thank you very much. I appreciate that.
Of course.
All right, any other questions for our panel? Going once, going twice, 3 times. First of all, I want to thank our guest for joining the county executive for his press briefing today. Appreciate you sharing the information with the reporters. Thank you, reporters, for joining us. Also want to say before we go, this weekend, don't know who you're rooting for, but make sure you do that safely. And please, on Monday, which I believe is Valentine's Day, I don't hope my wife isn't watching so she thinks I didn't forget, but make sure that you spread the love to make sure that people get vaccinated, get boosted. That's the greatest love that we can show around this time in the times that we're in. So thank you very much. On behalf of the county executive, thank you for joining us. Have a great day and a great weekend.